Hi, I'm Dr. Henry Black, and a clinical professor of internal medicine at the New York University School of Medicine and president of the American Society of Hypertension. I want to talk today about the long-term follow-up of the United Kingdom prospective diabetes study. This was a very important trial done in England in the 1990s. The hypothesis was that tight blood pressure control, superimposed perhaps on tight metabolic control, would have favorable outcomes. About 5,000 people were entered into the study, and about 1,200 of them were hypertensive and qualified for the hypertension sub-study. The very important results from a hypertension perspective is that tight blood pressure control, averaging about 10/5 compared to conventional control, had a substantial reduction in cardiovascular events and diabetes-related events. Whereas tight glucose control achieved either with sulfonylureas and insulin or with metformin in those who were overweight also was beneficial, but much less so. The interpretation from our perspective as hypertension folks was that this really convinced us that our thoughts that high-risk people like diabetics would really benefit from treatment. And that became the grounding for a lot of our more aggressive therapy for diabetics. Well, the study ended, and as become common now, we follow patients who were in a trial after the trial is completed. And this was done in UKPDS as well. 2 studies have been published now, both in the New England Journal of Medicine in the fall of 2008. The glucose control study was quite interesting. Even though within a year or so, the differences in all metabolic parameters associated with tight glucose control came together, the benefits of tight glucose control continued throughout the remainder of the observational period, which in some patients was as long as 7 more years. This has been called the legacy effect. Even though you weren't carefully watching what the glucose was, what the hemoglobin A1C was, the benefits you saw in those first 5 years of aggressive management carried forth, and so-called legacy occurred. This has been seen in a trial called Consensus, which was a heart failure study with enalapril. You also saw benefit after the study was done. This is a very interesting phenomenon, because if you get good glucose control and then you lighten up a little bit, you don't quite push as hard, and you still get the benefit, we could even begin to think about tapering or maybe even drug holidays. This is a somewhat outrageous suggestion, I think, but one that we ought to be considering. Thank you very much for your attention.